aging into that period of their life. That's 40% of the population in 1964. So as you see down here on the graph from 1940 to 1980, it is a growing marketplace. When the Social Security Act was passed back in 1935, the first checks were paid out in 1937. In fact, Ida Mae Fuller, the picture on your left-hand side there, of Ludlow, Vermont, received the first benefit check on January 1st, 1940, after she paid in the system for 3 years. Living to age 100, she received some $22,088.92 over 35 years. So she got a little bit more out of the system than she put into it. Fast forward a little bit, Kathleen Casey, I can't say the last name, Kershley, when her birth occurred at a second past midnight on January 1st of 1946, she was officially the first baby boomer, quote unquote, first baby boomer. And again, you fast forward, and she qualified for Social Security on October 15th, 2007 for early retirement age 62. And that started the move of some 76 million, some people say 78 million individuals aging into Social Security over the next 25 years. So let's kind of look at that marketplace. We're talking about, you've heard it before, the America's Silver Tsunami. So during 1946 to 1964, 92% of women who could have a baby did have a baby. The average had 4 children, 2 times the previous birth rate of our country. They hit every stage of life together, from giving birth, going to elementary school, junior high school, college. They hit every stage of life together. Let's look at the post-World War from 1946 afterwards. You had 3,411,000 babies born. That was 6.49 per minute. When those individuals came back from World War II, they started buying their homes in the suburbs. Levittown up in New Jersey was the first one to build homes for them. From 1954 to the post-Korean War, you had 4,078,000 babies born, 7.76 per minute. In 1957, the year the boom peaked, you had 4,300,000. That's the number of babies that were born in the U.S., 8.18 per minute. Well, let me ask you this. Wouldn't this have been a great idea? Wouldn't that be a great time to market the products that these consumers were going to buy, that they all wanted at the same time? They were all buying diapers. They were all buying baby food. They were all buying toys and bicycles. So they're all having babies at the same time. They're buying homes and cars. They're putting their kids in elementary school, junior high school. Their kids are going off to college. They're all doing this at the same time. Wouldn't it be a great time to have a product that these people were going to buy anyway? Life magazine put out an article back in 1958, said kids built in recession cure. How 4 million a year make billions in business. Women's Wear Daily said that people spent $225,000 on clothing for infants in 1939, but by 1944 it was doubled to $420,000. By 46, it reached $700,000. It was higher than 47. Chicago Sun-Times reported that annual sales of baby foods rose 400,000 cases in 34 to 2,700,000 cases in 41. It just shows you that these people are going through these things all at the same time, and they're spending their money on the same products. Toy companies doubled between 1942 and 1947. The juvenile furniture production in 1947 was 54% above 1946, which was 39% above 1944. So it makes you wonder, as these baby boomers age into this later period of their life, what are going to be the products and services that are going to be booming for them? Time magazine named 25 and under as the man of the year. So the industries were created and fortunes were made as companies positioned and repositioned themselves to serve this demographic. Baby boomers bought mouse ears, hats to wear while they watched the Mickey Mouse Club, coonskin caps to wear while they watched Walt Disney's TV specials about Davy Crockett. They bought rock and roll records, danced along with American Bandstand and swooned over Elvis Presley. They collected hula hoops, frisbees, and Barbie dolls. And millions of them watched Wild Kingdom. Who put on Wild Kingdom? I'll have to think about that. January 1st of 2011, the first of the baby boomers started turning 65. Approximately 8.4 trillion will be inherited by these boomers from their grandparents and parents and others over the next generation. By December 31st of 2029, the last of these boomers are going to turn 65. The 64-year-old population segment is projected to double to 71.5 million by 2030 and grow to 86.7 million by 2050. Possibly 80 million plus will be on Medicare and Social Security. This is the first generation to be studied so intensely by marketers. Stemming back as early as the Newsweek article of August 9th, 1948, you can go look it up, Population Babies Mean Business. And now these babies are your clients. Now these babies are going to make up that baby boomer generation that's aging into retirement. So just as these people were born within 18 years of each other, they're also going to be retiring within 18 years of each other. In this era of longevity, they're going to average another 25 years in life, some longer. So in retirement, they're going to spend as much or longer time in retirement than they did in their working years. There's a variety of real possible that they could spend as many years in retirement as they did in that workforce. And many will be looking at an encore career to help supplement their retirement. So thanks to the tremendous advantage in medicine, this baby boomer wave isn't just about post-65. Between 2020 and 2039, that means next year, starting next year, between 2020 and 2039, the boomers will expand the 75 and over population by 93%. Between 2030 and 2049, 85 plus will climb to 113%. And in mid-century, this is astounding, 65 plus will outnumber age 15 and younger. So what we've talked about is that everything that this baby boomer demographic has been predictable. Everything about them has been predictable. So have you considered that everything about them as they age into retirement is also predictable? History taught us at the beginning, at the end of World War II, we know what they're going to do as they age into this twilight period of their life. We know what they're going to buy. We know when they're going to start buying it. We know what products are going to cost. We know where they're going to get the money to pay for those products. And let's have a look at how we know that. So what happens at retirement? Let's take a profile client. Let's say your average client is 65 years old. The average person turning 65, if he's a male, 65, 66, depending on when he was born, to file for Social Security. The average person, the average male that's 65 to 66 years old, is going to do three things almost without exception. He's going to sign up for Social Security. When he signs up for Social Security, he'll automatically be enrolled in Medicare. In fact, if he's going to continue to work for a little bit, he'll opt out of Part B. And 80% are going to get some kind of supplement. So we already know these three things about our senior prospects before we ever talk to them. We know they're going to sign it. He's going to sign up for Social Security. We know he's automatically going to be enrolled in Medicare. And we know that 80% are going to get some kind of supplement. So what else do we know about them? Well, let's drill down a little bit. We're talking about moving them from health insurance to Medicare. So let's drill down a little bit more and see if there's anything else we know about them. So when we look at this target market, we said a male turning 65, on average, his wife's going to be how old? 62, 61, 63, going to be a little bit younger than him on average. So if he's turning 65, his wife is what, 62 years old? So he's going to sign up for Social Security. When he signs up for Social Security, he'll also be getting his retirement from his work. When he signs up for Social Security, he'll automatically be enrolled in Medicare. Again, if he's going to continue to work, he'll opt out of Part B, right? And when he does this, he's going to get some kind of supplement, maybe a Medicare supplement, Med Advantage plan. But is there any, so we know those three things about him. We know he's going to sign up for Social Security, automatically be enrolled in Medicare, and 80% are going to get some kind of supplement. Is there anything else we know about him? Well, yeah, we know what product they're going to get, the supplement, whether it's a Med Sup or a Med Advantage. We don't know that, but we know it's going to be some kind of supplement. We also know what the product costs because it's filed in every state. Is there anything else we know about them? Well, we know where they're going to get the money to pay for these products. They have already been paying for the health insurance for the last 25 to 30 years. They're already spending $8 to $12, $16, or $20,000 a year for health insurance. Even if they've got group coverage, they're still paying for dependent coverage, aren't they? So we already know what they're going to do. We know when they're going to do it. We know what product they're going to get, some kind of supplement. We know where they're going to get the money to pay for it because they're already paying for health insurance. That means that he's going to reposition $1,800 to $2,000 out of his monthly disposable income to pay for this Medicare supplement or this Med Advantage plan. And when he does that, something else is going to happen. That's going to free up money to pay for a final expense product. But the other thing that's going to happen is we know that his wife is then going to need her own standalone health plan, isn't she? Whether it's a major med, simplified issue, she's going to need some kind of standalone health plan. Now, we already know where she's going to get the money to pay for this, right? Because when he pulls that $2,000 out of his monthly disposable income that he's currently paying for his health insurance to pay for his supplemental plan, the balance of the money is going to be used to pay for his wife's own standalone health plan, whether it's a major med, simplified issue, maybe with a critical illness and accident rider. So there's the bridge to take people from their health insurance to their Med Advantage plan. Now, so what do we know about her? Well, we know what she's going to buy, some kind of health plan. We know when she's going to buy it, when he comes off of their health plan. We know what the plan's going to cost, right, because it's filed in every state. We know where she's going to get the money to pay for it because they're already spending the money in their budget. So when he repositions his money over to pay for his supplemental plan and maybe a final expense, she's going to take the balance of that money to pay for hers. And what else do we know about her? Well, we know that in 2 or 3 years, she's going to age in, and she's going to sign up for Social Security. If she doesn't sign up for early Social Security, she's going to automatically be enrolled in Medicare. So if she signs up for early Social Security, when she gets 65, she'll get Medicare. And we know that she will then need to get her own supplemental plan. Now, we know when the plan costs because it's filed in every state, right? And we know where she's going to get the money to pay for this because she bought her health plan from you. And we know that as she ages into Medicare, we know everything that's going to happen to them in their retirement years. So we already understand the market before we ever talk to them. The question is, as they make this transition into their retirement years, how can we help them bridge this gap from their health insurance plan to Medicare? Well, for him, if he's turning 65, it's pretty easy to do that. We simply reposition the money he's already spending on his current health plan, put it into the supplemental plan. But now we have to help the wife. We have to help her get a plan that's affordable, that will cover her needs, and help her prepare for when she ages into Medicare. And you can do that by helping her with the bridge plan. The bridge plan fills the gap between health insurance and Medicare. Who is it for? It's for affordable health care for people 60 and over. It's a perfect plan for folks trying to maintain affordable coverage until they are Medicare eligible. It's perfect for older foreign nationals moving to the States and having to wait to get Medicare. And it's perfect for when a spouse loses coverage because they are dependent on their spouse's group policy and they become Medicare eligible. And this is what's great about the plan. It's a major med, insurance plan. While they're waiting to enroll in Medicare, they can apply for the coverage. The bridge plan is set up to be as simple as possible. There's no copays, no coinsurance. You can talk to Cliff for more information on this and get more details. All eligible expenses are applied to the deductible. Once the deductible has been fulfilled, the policy covers 100% of the policy maximum. So here's how it works. It mirrors Medicare. It has a Part A, that's hospitalization, just like Medicare. So covered expenses include semi-private rooms, board charges, general nursing, miscellaneous hospital services and supplies, drugs, x-rays, laboratory tests, just like Medicare does. That's hospice facilities. That includes medically necessary outpatient treatment. Skilled nursing facilities. So costs that are covered include necessary hospital confinement 3 days or longer and begins with 30 days following the hospital confinement. And home health care. That's skilled care at home. So it mirrors Medicare Part A. It also mirrors Medicare Part B. Physicians and surgeons covers the cost of physicians and surgeon services, either as an inpatient or outpatient, just like Part B. The additional benefits are supplies, therapy, and ambulance services. The policy period it's a temporary plan and has a maximum policy period of 364 days and can be renewed. At the end of that 64 days, you just apply for the new term of insurance. First, you have the free look period, like you always do. You get treated by any doctor at any hospital. So what do we tell our senior clients with Medicare supplement? You can go to any doctor, hospital, or clinic anywhere in the country that accepts Medicare assignment, show your benefit card, receive your medical care, leave, and never see a bill. So this mirrors that. The benefits are based on usual and customary and reasonable charges. Deductible is on a per policy period basis. And of course, the plan can include either Part A or Part B. So the network coverage, First Health Network, in all 50 states, 5,000 hospitals, over 90,000 ancillary facilities, over 1 million healthcare professionals. You can receive your diagnosis and treatment and sickness and injury from the provider within the PPO. You have the option to see any provider, whether in network or out of network. Now, first, if you go out of network, you're not going to get the discount. But most people know that. Most people want to go to their doctor or provider in the network. And this is how it fits for her. So remember, he's 65 or 66. He signed up for Social Security. He's automatically enrolled in Medicare. 80% of them are going to get some kind of supplemental plan. He's going to reposition the money that he's already spending 8, 12, 16,000, maybe 20,000 a year for health insurance or more. Even if he's got group coverage, he's paying for dependent coverage. He's going to reposition that money to pay for his supplemental plan. And then his wife's going to need her own standalone health plan, which is what this would be. If he opts out of Part B, he could get the Part B of this to cover himself at the same time. So look at this. If she's 62 and she gets the Platinum plan with $1 million maximum benefit with a $1,000 deductible, what plan can you afford to get today that's a $1,000 deductible? Only $441 a month. He gets even the Bronze plan at $100,000 maximum benefit with a $10,000 deductible for a 62-year-old. It's only $155. It's a really, really great plan. It fits a special niche. And here's something else it does for you. It keeps other insurance agents out of your prospect's home, out of your client's home. Because when you get that supplement with them, if you don't take care of the health needs of the wife, then you're inviting another agent to come in there. And there's a good chance they're going to steal your business, your supplemental business. I would. So this plan has a lot of benefits for clients who are kind of left hanging out in the cold, whose health insurance has become so expensive that things that were staples to them have now become luxuries. And you can help them completely change their lifestyle. They can go to any doctor, hospital, or clinic, pay their deductible, receive their medical care, leave, and never see a bill. There's some state-specific things on here. You need to talk to Cliff about that. So who needs the bridge plan? Well, the first Medicare restriction is Medicare usually accepts people who've been a permanent resident of the United States. That doesn't require citizenship or any prepayment in Social Security prior to eligibility. The only requirement is they must pay a monthly premium to have both Part A and Part B. So the bridge plan is available to those individuals that become permanent residents and who are within the 5-year waiting period for Medicare eligibility. So you can fill that gap. The second is some people may be eligible for Medicare due to age and qualifications, but they fail to enroll. You've gotten those phone calls before, right? Enrollment's not necessarily automatic. So Social Security does not remind people to enroll. If a person misses the enrollment period, then they have to wait to enroll at a later date. That process could take 18 months. You've gotten phone calls like that before. This plan covers the person with benefits similar to Medicare until the next enrollment opportunity. And some people, for different reasons, have only Part A or Part B. They may be able to acquire the additional part through Medicare, but at a later date. So with this plan, it can be sold with both Part A and Part B, or just Part A. This is what I love about this plan, or just Part B. So when he opts out of Part B because he's continuing to work, you can fill that gap by putting this plan in there for him because he can get to Part B. Talk to Cliff about it. He can give you some, answer your specific questions about it. Look at the application process. How simple is this? It's a fillable PDF, 1 page. You don't have 9 pages. 1 page, very simple to go through. Cliff can give you more details on it. We can get a copy of it for you. So it's very easy. They just click the radio box, enter their name, date of birth, height, and weight, answer these basic medical questions. There's only 10 of them. Answer these 10 questions, and then sign it, and that's it. It's so easy to get. And you're on the phone with them anyway. You're sitting there in front of them anyway. You're helping the husband anyway with his supplemental plan. The pivot is so easy. Mary, now let's take care of you. Mary, let's take care of you. There's some limitations. You know, all plans have limitations. Alzheimer's disease is limited to a lifetime maximum benefit of $25,000, but it's covered. A lot of plans don't even cover that. Cataract surgery, cardiac and cancer-related conditions are limited to a maximum benefit of $25,000. That's for the first 180 days after the inception, and after 180 days, everything's paid for any other condition. There are pre-existing conditions. The Cliff can give you more information about that. I'm not going to go through all that with you. Look at this one. I think this is great. Complications due to hypertension benefit. Health complications resulting from medically controlled hypertension will not be considered a pre-existing condition. Some people say that applies to me. And of course, termination of benefits is standard. So what do we say happens at retirement? We know that people are going to do 3 things. We know if a male's turning 65 or 66, on average, his wife is 62, 63. We know he's going to sign up for Social Security. We know he's going to automatically be enrolled in Medicare. In fact, if he's going to continue to work, he'll opt out of Medicare. That's where, on the other slide, we talked about sometimes they don't have that. And we know that he's going to get some kind of supplement, Medicare supplement or MedAdvantage plan. 80% of them are going to get some kind of supplement. So when we look at that target market, we know that he's already spending $8, $12, $16, maybe $20,000 a year for health insurance, if not more. He's going to reposition that money. He's going to get his retirement from work. He's going to reposition that money. When he gets signed up for Medicare, when he repositions that at $1,800, $2,000, he's going to use that to pay for a supplement. He's going to take the balance of that money, and if you're smart, we'll cover this in one of our upcoming webinars, you're going to package a final expense with that. But we also know that when he comes off that health plan, whether it's a standalone plan for him and his wife or a group plan, that his wife is going to need her own standalone health plan. And this is exactly what this is designed to help you do, capture those lost dollars. Pick that money up that you're leaving on the table, maybe with a critical illness and accident rider. And what else? What do we say we know about this? We know what he's going to do, when he's going to do it. We know how much the product costs. We know where he's going to get the money to pay for the product. We also know what she's going to do. We know what his wife's going to do. We know when she's going to do it. We know what her product's going to cost. I just showed you the rates on those. We know where she's going to get the money to pay for it. There's something else we know. We know that you're building in a renewal base because in a couple of years, she's going to turn 65. She's going to sign up for Medicare, and she'll have the money to move over to get her own supplemental plan. So it's all predictable. Just like the reason I went through those slides in the beginning, when the baby boomer generation started, over an 18-year period of time, they all went through the exact same lifestyle issues. And as they age into this next phase of their life, they're also going to go through the exact same issues. This empowers you to have impact in their life. This enables you to influence the benefits that they'll receive. It'll have a direct impact on their life as they age. You will be able to have an impact on their lifestyle because you will be able to take the dollars that are hurting their lifestyle right now. You're going to be able to move them so that they don't have to make a choice between things that were staples in their life becoming luxuries in their life. You will free that money up for them. And that's what you want to do, right? The Bridge plan is an affordable health insurance plan for people 60 and over. The perfect plan for folks trying to maintain affordable coverage until they're Medicare eligible. It's perfect for older foreign nationals moving to the States and having to wait to get Medicare, that 5-year window. And of course, it's perfect when a spouse loses coverage because they are dependent on their spouse's group policy and they become Medicare eligible. Where could you get better rates than this? These are super rates. Now, the other thing that's great here is any money they pay out of their pocket it applies to the deductible. So they can get that $1,000, $2,500, or $5,000 or $10,000 deductible taken care of in a year easily. To get more information, call Cliff Woodruff. His email is cliff@aeci.us. His phone number is 678-426-1503. He can give you information on the product, how to get contracted for it, the commission rates, give you all that information. You can go to the website for more information. This video, this webinar we're doing is going to be, the replay of it's going to be posted on the website. And in a little while, everybody that registered for this webinar is going to get an email where you will get a link. So sometime this afternoon, you'll get an email with a link that will give you the ability to go in and download the brochure on this and be able to watch the replay. You can also call Will Smallwood. His email is will@aeci.us. His phone number is 678-426-1505. And the website again is aeci.us. So listen, when the husband signs up Social Security and is enrolled in Medicare, he's going to buy that supplement anyway. So he should buy it from you. When he repositions that $2,000 to pay for his supplement, his wife's going to get her own health insurance plan anyway. She should just buy it from you. And when she takes that money that she's already been spending for health insurance and repositions it to you and helps build your wallet share in the home, helps build your book of business, and builds in renewal income for you, she's going to turn 65 anyway and get a supplement. She might as well buy that from you. And she's going to have the money to get that supplement because she's already spending it with the health insurance she got from you. So I appreciate you being on the call today, American Eagle Consultants. Make sure you go to the website. I'm Lloyd Lofton with Power Behind the Sales. I'll leave the contact information up on the screen for a few minutes. Cliff Woodruff, email us cliff@aeci.us. Phone number 678-426-1503. Email Will or Cliff any questions about the product. Find out how to get contracted for it. Find out how to figure the rates. I showed them to you. They're really, really simple. One-page application. You can't get easier than that. You're talking to the husband anyway. The pivot is, Mary, let's get you taken care of. You're not asking her if she's interested. You're not asking her if she'll do it with you. You are assuming that it's your job as a highly trained licensed professional to make sure that she doesn't have exposure. Their finances are not exposed. Their assets are not exposed to unpaid health bills because they said they were going to take care of this later or they think about it. You now can say, Mary, let me get you taken care of. Pretty easy to do. So I'm Lloyd Lofton with Power Behind the Cells. You can go to powerbehindthecells.com, get more trainings, get more free downloads. Remember the messaging. You want to pull them in towards you with true perspectives and values rather than pushing your products and services. You want to identify potential challenges to your message and address them directly. Be transparent. Just start the conversation with the client. It's been great being on the call with you. I'm going to end the webinar now. Remember, this afternoon, you're going to get an email. It will have a link so that you can watch a replay of this video. You can also request the download of the brochure. Give Cliff and Will a call right now. Make sure that you ask them exactly how to get this. You want to ask them, maybe you got 1 or 2 clients you want to pull in your out of your drawer right now and ask them about that. So have a great week, and we'll talk to you in 2 weeks.